I'm so grateful to be here with you guys and to be back at the Silicon Valley Health Institute. I know this is a virtual get together, but I just fondly remember the times I was there in person. And Susan, thank you for an amazing introduction and thank you for having me back to the Silicon Valley Health Institute. I'm really thrilled to be here and I love the mission that you guys are doing. Cutting edge, uncensored, open, honest, intelligent conversation with, one of the things that I think in medicine, a lot of times they say, okay, we're looking at evidence-based medicine, evidence-based based on who's providing the evidence often is the case, right? And then in med schools and in residency, it felt like dissuading our clinical opinion, our clinical expertise, our clinical, aptitude. And when it's come to my practice of medicine, my practice of, helping my patient heal themselves and getting to the underlying root cause, it completely relies on clinical skills and understanding basic science, right? Looking at basic science research versus honest to goodness, pharmaceutical-based clinical outcomes and how that limits our real intelligent ability to help patients. And I think that's what I do differently. That's what I've learned to do differently based on my experience clinically, but also professionally and being a scientist. I was a scientist. This isn't in my bio. So you guys, a little scoop. Right out of university, I worked for the US Navy in diving medicine, hyperbaric medicine, and I did exercise physiology. And so I was a published scientist at age 22, presenting internationally to the Royal Medical Society in England and US Navy and medical sciences. And biomedical science is fascinating to me. And so I carry that into my clinic. I carry that into
the
my
freezer. Oh,
yeah.
right.
So I carried that into my clinical practice. And I'm thrilled to be here with you today. Okay, let's see here. Thank you for that. All right. Mute all. Can I make you a co-host in case that happens again? If people come, I think they come in unmuted. Sorry about that, you guys. You guys hear me okay? Let me find Susan to unmute her. We're not technologically challenged today. No, sir. Okay. I think that's got to be you, Susan. So let's see. So, right. So we're going to talk about biohacking for longevity. Longevity is, goes beyond how we are physically, right? We want to improve our physicality and we want to improve the number of our days, right? The number of our days, how long we live, but even more importantly, we want to improve the quality of our days, the quality of our life. And when it comes to biohacking for longevity, one big area that we biohack is our hormones. And I am here to answer questions about that for sure. But I want to tell you that what I've learned from my own health journey and my own experience is that it takes more than hormones to fix your hormones. And in fact, that's what I presented the first time at Silicon Valley Health Institute. I know that recording is available on YouTube, and I love that. I want to share with you just some really key areas of addressing underlying conditions and how we can really improve biohacking for longevity. Some of the key areas that we're looking at now is stem cell therapy and peptide therapy, and certainly prescribing hormone replacement with, testosterone, DHEA, progesterone with or without a uterus, and how critically important that is. And that these hormones that we're prescribing are bioidentical, and that we're making sure that we're not including hormone disruptors in our regimens as well when we're making these prescriptions and these recommendations. But that I like to say is the top 10%, that fine tuning. Right? When we're still integrating many of these therapies, that's a lot of the fine tuning. We want to get to the underlying issues with hormones, for instance, we want to get to the underlying issues. We want to address the core hormonal changes that are happening. So I'm going to share a little bit of my story, and um, a picture says 1,000 words. So I think it gives you a perspective when I share this slide. And I don't like particularly to share this image, but I was well over 240 pounds at one point. I had tremendous hair loss, and I saw a question come in about hair loss, and you can see not an issue anymore at all. But in this slide, you see this tremendous amount of hair loss all the way going back to the crown of my head. And when patients would come in and say, Dr. Anna, I'm experiencing this hair loss, what is going on here? And I'll check their thyroid and say, okay, that looks good. Let's add some, biotin, some, iron, and let's, keep an eye on it. Maybe it's just a phase you're going through. This is stress-related hair loss. And what many people don't realize, that stress converts testosterone to dihydrotestosterone. And men, it looks like nice male pattern balding. And women, male pattern balding does not look nice at all. And that's what I had experienced with obesity, PTSD. And I was thinking recently, right? Like this is about biohacking for longevity. And I want to emphasize that it's the quality of our days versus the quantity of our days. And recently I was just thinking way back to this time period of my life when I remember pretty much every day being so depressed, not wanting to live, not even thinking how I could live. And now, I don't have to fake being happy anymore. I honestly don't have to fake being happy anymore. The physiology of happiness, and that's how we want to live, happy, joyful, is an internal environment, not completely independent of our external circumstances. And the physiology, the keto green way, if you guys have heard me speak, let me know if you understand what my keto green way is, my keto green diet and lifestyle. It is foundational to empowering a physiology that enhances our longevity or quality of life. Physically, our biomarkers will improve, some key biomarkers. Also, mentally, mental clarity, risk for dementia, Alzheimer's will improve. So using ketones for fuel over glucose, but doing it in a healthy way so it empowers our physiology. And more importantly, because the most important hormone in our body, oxytocin, is improved. And that is the hormone of longevity. If we biohack with anything, we want to make sure we are biohacking with the lifestyle hacks that empower the hormone oxytocin. And so don't hesitate to ask questions. I'm going to look at your questions in a few minutes. I'm going to share with you through this journey, through getting keto green, through going from infertility, traumatic PTSD to reversing that. And now this picture is a bit old here, but I love this picture. My youngest is soon to be 14. So I'm 55-year-old with a 14-year-old. And I like to say with the vagina of a 25-year-old. Okay. I mean, these are things that are biohacking longevity of quality of life. And these little things make a big difference. So hopefully you smiled at that. But I think it's very powerful to promote the physiologic change that we know we can do. While aging is natural, right? Suffering is not. And there's things that we can do to improve this. I show this image because as I went through my own journey in perimenopause and menopause, this time period, starting 35 to 55, is this time period of neuroendocrine vulnerability. Neuroendocrine vulnerability, this hormonal shift, and we associate it with perimenopausal symptoms, PMS, worsening PMS, but we also have peaks in divorces, peaks in burnout, peaks in at medication, and diabetes, especially diabetes and prediabetes in women, accelerates in the perimenopausal time period. So what's happening here? One thing we know is that certainly we have a decline in DHEA, it's a very healthy aging hormone. DHEA helps our bones, our breast, our brain, and it starts to decline for men and women in our 20s. And progesterone starts to decline for women in our mid 30s, and estrogen follows. And these symptoms that women experience, hot flashes, night sweats, I mean, there's the GYN symptoms that bring them into my office, the breakthrough bleeding, the irregular menstrual cycles, the discomfort with sex, the dysfunctional uterine bleeding, and dysmenorrhea, painful cycles. But there's the mood swings, the brain fogs, the lack of enjoyment in life, the anxiety, the depression. All of those are neurologic symptoms. So there's a neuroendocrine vulnerability here. And when I adapted to my keto green lifestyle, right, this concept of shifting from using glucose as a primary fuel source to ketones, I had brain clarity. All of these symptoms disappeared. Had brain clarity, the brain fog lifted. I no more anxiety and depression. I had that peace that surpasses all understanding. So it says in the Bible, peace that surpasses all understanding. Nothing in my external world had changed, but I felt good. I felt at peace. I could respond appropriately to my children versus react or overreact, let's say. And I hear that from many women, like, I don't know where this monster in me came from. I was just, something triggered me and I flew off the handle. I felt terrible. My children just looked at me like, what happened? Or my partner, my husband just looked at me and said, what happened? I mean, this is that neuroendocrine, it's a volatile, vulnerable time period. And so going through that recognition, this research came out in 2015, and it looked at glucose metabolism in the brain. And if you look at this red line here, maybe it's hard to see the colors, but that's the graph of glucose metabolism in the brain. And this was published in Nature Reviews Endocrinology, right? Small little, very professional magazine. So glucose metabolism in the brain starts to drop off in that perimenopause. We look back, it really follows closely to progesterone decline. However, estrogen is studied, and gluconeogenesis in the brain is estrogen dependent. This was a huge, this was such a huge aha moment for me. No wonder the use of, so here, glucose metabolism in the brain is dropping off similarly to our fall in progesterone, a decline in estrogen, creating this black line, which is endocrine and neurological symptoms that I just described to you. So you get this peak in endocrine and neurological symptoms, and it never goes to premenopausal states. However, if we shift to using ketones in the brain, it is not hormone dependent. So these symptoms completely can disappear if you do if you get into ketosis a healthy way for women, which I say is the keto green way, making sure we've got the alkalinizers in, we're feeding the gut microbiome. You guys have certainly had lectures on this before. So that keeps us from self-medicating. Statistically, by the time a woman reaches 55, which is my age now, she's on 3 prescription medications, the most common of which are antacids, antidepressants, and anti-inflammatories. So those 3 medications, well, what will that lead to? Inflammation and hormone imbalance. Inflammation and hormone imbalance. So we don't want that. I write about these in my books, and I do have a new book coming out called Menopause. Love the name, right? You got to love the name. So, so this is critical. And one of the things too, in this time period, we want to age well, right? We want to biohack and age well. So we want to reduce our risk of heart disease and cognitive decline. What was published in September of 2019 was these articles, these reviews of looking at women with hot flashes. So if you have hot flashes, that means that symptomatic hormone imbalance and inflammation, there's 2 times the risk of heart disease and cognitive decline. So that's what the papers addressed. What they didn't address, that number 1, the underlying reason for unremitting hot flashes is insulin resistance. So that's, again, a huge aha moment. When we have insulin resistance, we're at a higher risk for cardiovascular disease and cognitive decline. So getting keto green improves insulin sensitivity and improves cognition in general. So we see that across the board. And I put this slide in here because you know, at this time of life in perimenopause and menopause that women are going through, it's often, there was some brainwashing in the 1970s. I remember the commercial, the Angeli perfume commercial. It goes, if you can bring home the bacon, fry it up in a pan and never let them forget you're a man. It's a great song. And so it was, however, they were leaving out the chef, the personal assistant, the chauffeur, the maid, the butler. I mean, you name it. There are a lot of people missing in that commercial. So women in America were brainwashed into thinking, okay, yeah, we can do it all. No, we don't have to do it all, right? We don't have to do it all. We need balance, and we can have it all, but maybe not at the same time, not at the same time. So looking at that balance. And this also relates to sexual health and sexual function. I always talk, because I am a sexual health expert, when it comes to longevity, about maintaining sexual health for the rest of our lives. And then that's a critical piece, is to maintain sexual health for the rest of our lives. And not only is it just about sexual health, but it's bladder control. It's about, you know, yeast infections. It's about incontinence. It's about hemorrhoids. It's about, I mean, if there is discomfort in our pelvic floor region, then we have, you know, we're going to have discomfort. It decreases our quality of life. And because incontinence is the number one reason caregivers put their loved one into a nursing home, that this is where I say, this is why it's so important to address the pelvic floor in anything we're doing with biohacking, but often it gets overlooked, especially with women's health. And when it comes to men, you know, will go to their doctor and maybe they get their testosterone and their Viagra, and they're like, honey, look what I brought home. So, and then women's like, oh my gosh, you know, like that, you know, have vaginal dryness, having difficulty with sex. I get a bladder infection afterwards. I have a discharge and odor for days, or irritation for days. And I'm really struggling with this. And, you know, it's not working. It's not working. They become less receptive and disconnected. But so vaginal hormone therapy, and I mentioned at the beginning, vaginal hormone therapy, bioidentical hormone therapy is essential. I use my product, and I created my product Julva. So that's an over-the-counter option, or your physician can prescribe vaginal DHEA, vaginal testosterone, progesterone. There are progesterone receptors, hormone receptors in our fascia, all over our body. And that's why in this perimenopause, part of, along with neuroendocrine vulnerability and an increased risk of cardiovascular disease with rising insulin resistance, we have arthritic complaints, stiffness, pain with movement, decrease in motility. It's because, you know, with lack of flexibility in fascia. So adding back, and again, the pelvic floor, like every other part of our body, is lined with fascia. And this is why there's an increase in incontinence and prolapse, and as well hemorrhoids during this time. So adding bioidentical hormones back in a clean way is a nice adjunct to that. So let me bump back out of here and see. I've been chatting for a while. I want to see if you guys have any questions before I continue on. Okay. Let's see. All right. Okay. So Anjali said, I'm in my 60s and not taking hormones. What biohacks do you recommend at my age? So I love, again, number one, getting keto green, right? Coming off of using ketones for fuel. Use of ketones for fuel is more powerful than glucose for fuel. I say glucose is to gasoline as ketones are to jet fuel. And this is certainly true post-menopause. Now, I do like metabolic flexibility. In menopause, there are 5 different 6-day menu plans to kind of see, okay, what fits you best at this time. But so that's critical. When we're at our screens, we should be using blue light blockers. So I don't see anyone using blue light blockers right now, but we definitely should be using blue light blockers. And typically after 2 or 3 in the afternoon, I'm usually putting on my blue light blockers anyway. So that's a key thing. Red light therapy is another huge biohack that I use. It's good for hair growth. It's good to decrease inflammation, as well as infrared sauna. So those are a few of the biohacks that I really love. And I use bioidentical progesterone. I probably optimize DHEA and testosterone levels, but always addressing the adrenals first and working with supplements and adaptogens to boost your own natural production of DHEA and progesterone. And number one biohack, and I'm sure you've had talks on this, is sleep, getting a really good night's sleep. Ellen said, what are your thoughts on keto diet for women with hypothyroid and Hashis? I recommend keto green. I recommend keto green. And the big thing is to decrease inflammation and balance hormones. And that is an important piece. And I've come head to head with one specific thyroid expert. He's like, I can't recommend keto and thyroid. Well, I have seen in my menopausal, perimenopausal, postmenopausal women in my online and in my personal practice that we see an improvement in TSH and free T4 and free T3. Now, if you are keto for a long time and maybe you're not doing keto green and you're having elevated levels of cortisol, if you're not taking a break in keto, we may see a reduction in free T3. But I always say, look at your free T3, free T4, TSH, and thyroid antibodies, So Louise asked, what are blue light blockers? These are a little extreme. These are some example of blue light blockers. These are red ones, and they block the blue light from your computer screens. And then there are other ones that are slightly yellow or tinted. Because I'm wearing my regular eyeglasses, there's some blue light protection here, but you can see it's not very much compared to these, or certainly at nighttime. It's great if you have to use the screen to use red protector, red lenses. That can make a big difference. And that helps otherwise these blue light interfere with the melatonin production. And that affects really other hormones in our body as well. We see increased use of blue light screens associated with lower testosterone levels. And so we, want to address that and block that. Another free hack, if you're sitting at a computer, you can use f.lux, f.lux. It's an app you can put on your desktop that will turn to a little reddish background as the day goes on, but you still want that additional blue light blocker. Great, okay. So let's see here. Mercedes said, I understand that once one goes into menopause, we need to start worrying about our bones. So need calcium supplements. Anything you can say on the topic? So number one, when we are breaking down bones, it's typically related to elevated cortisol and decreased protein and elevated and high levels of inflammation. So naturally, as we get older, all our reproductive hormones decline, they dip, but lo and behold, insulin increases and cortisol increases. So that makes more insulin resistance and more cortisol. And so that is a catabolic hormone that breaks us down. So this is where Mercedes, what I use in my hormones, especially if they have, first of all, get keto green. And one thing that's really important, and we know this from the work of PhD Dr. Susan Brown, she's looked at alkalinity, and the higher urine pH, the less risk of osteoporosis and osteopenia. So I have my clients always checking their urine pH, especially this measures urine ketones and urine pH. And we want your urine pH to be above 7. A urine pH that is more alkaline, so the greater than 7 it is, the more alkaline your urine pH is. So a urine pH above 7 is associated with a decreased risk of osteoporosis, decreased risk of metabolic syndrome, and decreased risk of cardiovascular disease. And what we know is that elevated uric acid is associated with a more acidic urine pH too. So the higher your urine pH, there's healthier. It's a marker because When we're stressed, we're breaking down our bone, for instance. And again, women and men are different. Men have 10 times as much testosterone. That's more protective than what we have as women. So it's important to understand that. And so I use progesterone, testosterone, and DHEA in women, but I also support the alkalinizing aspects of the diet with herbs and supplements, fermented foods, and checking urine pH to make sure that that is optimal to improve your bones, Okay, good. And I'm going to go back to my presentation for a second here. Oops. All right. So this is just a comparison between age and cardiovascular risk in diabetes. For women, again, once we hit menopause, if we are pre-diabetic or diabetic, we have a significantly increased risk of diabetes. And once we hit perimenopause, our risk starts to go up exponentially. Men have more of a linear time frame. And so one of the key things that I recommend to stabilize your blood sugar and reduce your risk is this whole keto green, keto alkaline concept. It looks healthy. It's clean food. This is zucchini pesto. This was in my kitchen. Zucchini pesto with cardamom seared scallops. I use a lot of herbs and spices. And in my new book, Menopause, I integrate foods from around the world because the ancient physicians to the kings were their chefs. They prepared their food. So a lot of the herbs and spices we've come to love are from medicinal reasons. And certainly when it comes to perimenopause and menopause, certain herbs and spices and foods are better than others to help us stay grounded, to keep us from getting hot flashes, and to promote insulin sensitivity. So we want to do that. We want to improve that. And so that we have less reliance. And I can tell you that in working with my clients in this keto green lifestyle, we are often within a few months able to start reducing dosages of medication and see tremendous improvements in health markers. This client, Debbie, who was 66, weighed over 205 pounds, and she had complete, decreased mobility and was really struggling. Her inflammatory marker was HSCRP. You guys need to know your numbers. Know your numbers for yourself. Don't expect your doctor just to tell you when you're optimal or normal. So her HSCRP was 32. It should be 1. It should be 1. Her hemoglobin A1C was 5.7. So that's like getting close. 6.0 and greater is pre-diabetic, but why wait? She wasn't told to worry at all. Following these recommendations of the keto green lifestyle, she lost 50 pounds, no more joint pain, was active and happy, no more hot flashes. Her inflammatory marker, HS, highly sensitive C-reactive protein, went down to 2, and her hemoglobin A1C dropped to 5.4 in a short amount of time, comparably. So this is like when we look at what's acidic, grains are acidic, artificial sweeteners are acidic, sugars are acidic, certainly dairy and meats are acidic. And then more on the alkalinizing, we have healthy, greens and herbs, and we want to look at low carbohydrate alkalinizers to make sure they're in our diet. And this is what I held up. Oftentimes we are doing a keto diet, so to speak, but we're never measuring. And checking urine ketones is a good measure, especially when you're starting out. And looking at urine pH, that's a critical measure. And we know, again, this combination to get into ketosis and to get alkaline at the same time, these strips cost pennies a day to use. It is just such valuable biohacking information. If I give you nothing else in biohacking and longevity, get this combination, get into ketosis with an alkaline urine pH at the same time and see what that feels like. It feels amazing. And we know from the work of Dr. Johnson and the new book, Drop Acid by Dr. David Perlmutter, that other biohack is to get your body rid of uric acid, to rid it so that your serum levels are less than 4.4. And that's a critical piece of what we're doing. And again, it's not just about what we eat. The other things that affect your hormones are sleep, getting a good night's sleep. And I saw a question on insomnia. Blue light blockers will help. Red light in the evening, magnesium, melatonin, and progesterone are beneficial. I use a magnesium L-threonate that crosses the blood-brain barrier. So not all magnesium are created equal, just like not all wines are created equal. And then creating a nighttime ritual using essential oils can be a tremendous part. Blocking EMFs in your room is another part to help you get an undisturbed good night's sleep. And any blue lights, red lights in your room, little indicators, black those out, put tape over them. Make sure you're sleeping in a completely dark room and around 65 degrees, dark and cold, as if you were sleeping outside on a nice evening. And in the middle of the night, it gets really dark and really chill. And that's by evolution, our body will trigger a deeper sleep and longer REM sleep. So hormone disrupting chemicals, I'll actually be speaking in France at Women in Tech. I'm invited by Dr. Crystal Johnson out of Nassau to be on a panel representing this key topic, hormone disrupting chemicals. There are over 1,300 chemicals that have been banned in the European Union that are known to cause cancers and hormonal issues and reproductive issues. And of those, only 67 in the US have been banned. Only 67 compared to what the EU has banned. Now in the US, but we have 100,000 more that have yet. We're just waiting for the problems to come up, and then maybe we'll ban them, maybe we won't, but it blows my mind. So when it comes to reproduction, when it comes to longevity, hormone disrupting chemicals have to be out. You do have to look on your ingredients, your skincare products. What you put on your body is as important as what you put in your body. What you surround yourself with is also that important too. Like what are you washing your sheets in? What are you washing your clothes in? And that comes to women with gynecologic issues, tampons, pads, laundry detergents, that affects our pelvic floor. So I see a lot of thinning and premature aging of the vulvar vaginal area, the perineum. And I believe this is significantly due to many of the hormone disrupting chemicals. So clean soap, like olive oil soaps, are great to use and are clean. And choose your chemicals, choose your toxins wisely. And this is a really big area. So we've seen also with endocrine disrupting chemicals increase insulin resistance. We've seen this research in children. This was published in May 2020 in Biomedicines, and it showed a statistical link between exposure to pesticides, bisphenol A, phthalates, and polycyclic hydrocarbides and dioxins with insulin resistance. Same is true with us as we get older, and that insulin resistance increases our risk for dementia and Alzheimer's. So stress is a big topic, and I don't know how much time I have to go into it today, but I definitely write a lot about stress, cortisol, oxytocin connection. Cortisol is a pro-aging hormone. If you look at the presidents that we've had between 4 and 8 years of office, you see rapid aging. That is the effect of cortisol. Creates this rapid aging. And the opposite is true. Oxytocin, the hormone of love, bonding, and connection, is associated with longevity. And there's even things that you never even thought about that can affect your day-to-day quality of life. This slide, I think, is so important to look at. This is our vitamin D level. There's very few things. I get on a soapbox. I mean, you guys can tell I'm very passionate about this stuff, but there are very few things that make me angrier when I have been referred a breast cancer client to help, and I check her labs and I see a vitamin D level in the teens. That just is so aggravating to me. They've been through mastectomy, maybe radiation therapy or chemotherapy, and no one's looked at their vitamin D level or optimized their vitamin D level. And so it used to be that our normal vitamin D was 20. and greater. Now I mean, really, it should, at minimum for me in my practice with my patients is 50 nanograms per milliliter of vitamin D in a serum blood test. No, the higher your vitamin D level is, the less risk of cancer. My breast cancer patients, I want their number to be at 80 nanograms per ml. So if we do, and nothing else, optimize vitamin D, but it's not enough to take a vitamin D supplement. Vitamin D is, can lead to calcifications. And I think we're seeing that by inappropriate supplementation, self or otherwise, with vitamin D, an increase in calcification, hardening of the arteries, benign calcification on breast imaging, etc. Vitamin D says deposit calcium. We need vitamin K2 on board. Vitamin K says where? We want it in the bones, not in the blood vessels. So vitamin D, K2, vitamin D3, K2 combinations. And that's what I recommend. We use the Ray of Sunshine supplement that has 10,000 IUs of vitamin D3 per capsule with 250 micrograms of K2. And I like that proportion. So, the basic things that we can do is getting keto green, intermittent fasting, and I'll give you a day in the life of keto green. Just put in the chat box that you want me to give you a day in the life of being keto green. Intermittent fasting is essential. If research has shown in 2016, looking at women with breast cancer, that if they had at least 12.5 hours between dinner the night before and breakfast, they had a significantly reduced risk of recurrent breast cancer. Significant, and that should have been headline news. So for me, it's at least 13 hours. I prefer 16 hours. My second book is Keto Green 16. That's with 16 hours of intermittent fasting. And I typically say for women, 13 to 18 hours of intermittent fasting on a regular basis. Now, and that should definitely be integrated into your biohacking lifestyle. Check urine pH as one of the most important biomarkers we have, and get that urine pH reading to be greater than 7 when you go to sleep and when you wake up in the morning. These are key blood tests I like all my patients to have, and I've added in uric acid level. We want that above 4.4. Hemoglobin A1C, we want that less than 5.3, closer to 5.0. Vitamin D, 25 hydroxy levels, we want that greater than 50, in the 50 to 80 range, or close to 80 if you have any autoimmune diseases or cancer. Homocysteine level in the 6 to 8 range, 6 to 8 homocysteine. It can be normal up to 11. That's a red flag. That's a methylation defect. And then inflammatory marker, HSCRP, CRP, C-reactive protein. We want that 1 or less. It'll read less than 1. This is the highly sensitive CRP, or cardio CRP, not a plain CRP. There's a big difference. This is more sensitive. And then a marker of your adrenal status, DHEAS. DHEA is sulfate when we're measuring serum in the blood, DHEA when we're measuring it in the saliva. And we want it to around 200 for women, 300 for men. And monitor them regularly. You can order blood tests on your own. If you don't have a lab that you can do that from, let me know and I can share mine with you. And then CGM, continuous glucose monitoring. That is a biohack. I wore a continuous glucose monitor basically for a year when I was creating recipes for my second book, Keto Green 16, to make sure that all the recipes and combinations just kept your blood sugar really well stable. I'll periodically put another continuous glucose monitor on, especially when I'm hacking or doing another plan or trying a different program, etc. And then community. Community is key when it comes to longevity. We know that all the blue zones in the world are associated with healthy community. And that connection is incredibly, incredibly important. So, yeah. So let's look and see what questions you've got here, and I'll address more questions. Mercedes said, I'm in my late 40s, but never heard about keto green. Can you please elaborate what that means? So keto green is the lifestyle that I developed through my own journey in working through menopause. When I was 48 and I was sinking into this, deep, dark period of what, I now refer to as a period of neuroendocrine vulnerability, right? The hot flashes, the night sweats, the irritability. and weight gain without doing anything different. Let me tell you, Mercedes, when my patients would come in and say, Dr. Anna, I'm gaining 5, 10, 20 pounds and I'm not doing anything different. I'll draw some labs, I'll check them out. But in the back of my mind, I was like, sure, you're not. Really? What's in that purse of yours? You hiding some snacks in there? What's going on? And then that happened to me, literally, without doing anything. God will make me humble. Without doing anything different, I gained 20 pounds. And I showed you that image. I'd been well over 240 pounds at one point. And I lost that weight and kept it off. And then I saw the scale jump up 20 pounds. And any of you, if you've lost weight and kept it off, or you've yo-yo dieted, you're like, oh my God, when is this going to stop? I'll be 300 pounds before this stops. What's happening here, right? And so, that took me on this journey. So immediately I went into a ketogenic diet, which is known to have high fat, moderate protein, and low carbs, less than 40 grams of carbs per day, depending on multiple factors, but around 40 grams of carbs per day. And so, I was struggling. I felt like I was hitting a wall. I was irritable. I called it keto crazy or keto cranky. And as a single mom with a wee one in elementary school, a middle school, and a high school girls, and man, they will learn to manipulate you. I don't know if you guys have had teenage daughters, you can relate, but certainly that took me on this journey. So I was, getting into ketosis, but I wasn't feeling good. And so that's when I checked my urine pH, something I've told my patients to do, especially when I'm detoxing them, working on hormone balancing. I know the higher the urine pH, the calmer they are, the nicer they are, the happier they are. I mean, all these good things. And my urine pH was as acidic as as the pH paper read. So the low on the pH paper is 5. And maybe it was 3. I have no idea. I was probably urinating pure acid at that point. But that was an aha moment for me. And that's where I started adding the alkalinizers. So I was like, okay, I need to alkalinize my body's chemistry. And I'm not talking about blood pH. I'm talking about urine pH as a biomarker. And so I added in the dark green leafies, the beet greens, the arugula, the sprouted vegetables like broccoli sprouts, and also fermented foods to really help support my gut microbiome. That's key to hormone detoxification. As I did that, I became my urine pH increased to more alkaline level, over 7, and I felt better. But one thing I noticed, and this is what I write about in all my books, that when the mornings I would get up and walk on the beach, or the mornings I would get up and gratitude journal, I was more alkaline all day. And this is where I dug into the research to understand what's going on here. Well, when cortisol will increase urine acidity. So cortisol increases hydrogen ion secretion across the renal tubules, creating a more acidic urine pH. The more acidic urine pH is associated with diabetes, heart disease, inflammation, cancer, osteoporosis. So that's a big no-no. So everything in my program is not just about what we eat as far as those greens, but it's the alkalinizing thoughts, behaviors, lifestyle that can make a big difference. I mean, dehydration will make you more acidic. Stressful thought, anger, fear makes you more acidic. And so and not sleeping well and food sensitivities can all show up in the form of an acidic urine pH and help you troubleshoot what could be going on in your body. So with a keto green day, what that looks like, for instance, I'll give you a typical day for me. So before I even get up and get out of bed, I ask myself these questions. I reflect on what I'm grateful for. And I just delivered my first grandbaby. So I've got a lot. I just think of her name, Andalisa Rose, and I'm just, okay, totally lit up, right? As I delivered, so I'm obstetrician. So I delivered my daughter. My firstborn daughter, Amanda, allowed me to deliver her firstborn daughter, and all natural. We were in a birthing center. It was amazing. So huge oxytocin moment, right? It was oxytocin moment. So gratitude, when we express gratitude and love, that increases oxytocin and decreases cortisol. On a daily basis, we have to do this. We have to empower oxytocin thoughts and practices into our life so that we can overcome the negative effects of chronic stress and cortisol. And so, so I asked myself that question: where did I see love? What am I grateful for? And where did I or could I laugh at myself more? So those three questions, and then hydrate with a glass of water. And I usually will drink some of my Mighty Maca Plus, which is a superfood combination of antioxidants. And I'll typically just drink it with a, in a shot glass with water and just chug that down. I'm having some now mid-afternoon with hot water as a tea, again, an alkalinizer in between my meals. And then I'll go work out in the gym, hydrate at the gym, and then when I get home, and usually somewhere between 13 and 16 hours of intermittent fasting, and sometimes 18, sometimes longer, sometimes shorter. But typically around 16 hours of intermittent fasting, I will break fast. And it could look like smoked salmon with red onions and capers. So your capers are your alkalinizers as well as your onions. And you can serve it on a bed of arugula or steamed greens and drizzled with olive oil, seasoned with some Himalayan sea salt and some cracked pepper. And that's a perfect break fast with a keto green meal. Another option is to make a keto green smoothie. I love making smoothies because it makes my life easy. And it is something my daughter loves too. And I typically will make mine, then add some berries in. And my youngest is still at home with me. She'll soon be 14. So I'll make her some with her berries. And that would look like maybe a slice of avocado, some cucumber, celery, see what I have in the fridge in the way of greens. Maybe I'll put a slice of ginger in, and I can use some nuts or seed-based protein. I use my keto green meal replacement shake, which is plant-based protein powder with some MCT oil in it, and multivitamins and minerals. And if you don't have that, use like maybe a tablespoon of almond butter and or like a quarter cup of cashew nuts. It's a great protein, and blend that up. And you can add some cinnamon or spice, but that's another keto green breakfast. And then you can, like, typically you're not hungry till you break, till you have your meal in the evening. So I hydrate in between my meals. This is really important. Wait 1 to 2 hours after you eat to drink fluid, except for maybe 4 to 6 ounces with your meal. 4 to 6, not 46. 4 to 6 ounces with your meal. So you're not diluting your digestive enzymes. That's a huge biohack. Again, this is the 80, 90%. Then the 10% I'll touch on at the end is some of the longevity biohacks, the additional, like those cutting edge science geek ones. So, that's, and dinner would look like, last night, for instance, I sauteed up some fresh grass finished beef sauteed with a beautiful tomato sauce and onions and spices and herbs. And I served it over some cauliflower rice. And I love that. And a side of tabbouleh. So tabbouleh is a parsley salad. I don't use the bulgur or the cracked wheat. In my new book, Menopause, I give you my recipe for that. And I use broccoli sprouts instead of the cracked wheat. Some people will use cauliflower rice. I love the broccoli sprouts. First of all, they're easy and they're so nutritious and they're so hormone balancing. It's perfect. So tabbouleh and parsley is the natural diuretic, helps with detoxification, removal of lead, and good things like that. Many good reasons to add parsley into your diet. So, and that would be a keto green dinner. So, all right. So let's see here. Did that answer your question, Mercedes? So, and then Andrea asked, what should women my age, 44, do to help us with hormonal success of a history of high DHEAS? So one of the things is I use adaptogens too, and looking at what is high. Is it high for your age or is it optimal? Because sometimes we can be in an optimal range, 200 to 300 with DHEAS, and be flagged as high, but it's really optimal. So if you're not supplementing with DHEA, I look at that number in a few different ways. I would look at a salivary DHEA level, and I would also look at a urinary DHEA level, looking at your the steroid levels in your urine, because that can tell me about a metabolic pathway issue that you might be having. So I would look at that and see, and then I would certainly work on stress management, getting a good night's sleep, and maybe I'd use maca in you too as an adaptogen. So we use my Mighty Maca Plus in that. Virginia said, can you please repeat what kind of magnesium you use? Yes, I use magnesium. Oh, Mona put it in there. Magnesium L-threonate, magnesium L-threonate. And that's a good one. If you look on my website at dranna.com, I believe it's the Better Brain Sleep Formula. You just look at the ingredients and you'll see that magnesium L-threonate in that. Joanna said, yes, day in the life. So to continue, after I break fast and because I work all day, right? Then I'll have cook for me and my daughter who's here. And my firstborn daughter will be moving in with her firstborn daughter. So we will have a 3-generation household. How exciting. So, but, after part of my evening ritual is again, typically don't like to drink very much after I eat. Because number one, and with my patients, we don't want to get up in the middle of the night to urinate. I want my system to be, well digested so that it's resting and rejuvenating and repairing, and we get into a state of autophagy. So I often have a tea in the evening, maybe, 1 tea, I might put some essential oils in it, depending. I love orange blossom essence in the evening. So a little bit of that with hot water. And so I'll do that. And then a meditative practice, journaling and winding down. And that's after, of course, I've taken my daughters to the horse farm. We've walked the horses, to the ranch, we've walked the horses and have done some homework duties too. So but that nighttime ritual is really important for me to unwind and to get a good night's sleep, especially as an obstetrician in solo practice for many, many years. I've retired that practice, but that, sleep disturbances were part of my norm. So that good night's sleep, biohacking that good night's sleep has been critically important to my quality of life and certainly longevity. All right. Mary said, what about MTHFR mutations? Mary, I know this really well. I've done my genetics and I've looked at patients, especially MTHFR mutations increase the risk of miscarriages, preeclampsia, eclampsia, hypertension, diabetes, heart disease. And that's something I've helped my patients with. And I am in that group too. I've diabetes and heart disease on both sides of my family. I have all the genetic red flags for that. And at one point, my hemoglobin A1C was 5.7. As I mentioned, it's now at 4.9. I don't know if I mentioned it or not, but it's 4.9. And so it's been as low as 4.7. But it was up at 5.7. That's a huge difference. That's a huge biohack. Both my brothers are pre-diabetic. They got the same genetics as me. It's these lifestyle hacks that make a difference. So with MTHFR, you're looking at those methylators. And this is why the keto green approach is superior, especially for women, because we're adding in those methylating foods, and that's critically important. And then supplementing with it when we need to. Methylation supplementation has a bell curve. And just like stress, right? If we don't have any stress, we're on our couch and, we're lazy, we're not getting up, we're binge watching Yellowstone. Well, maybe I've done that. Okay. I'm going to give you another example. But, if you're, you don't have stress, you're not doing much. So you need a certain amount of stress, but you have too much stress, you're on the other end, you're tanking. The same with methylation supplementation. There's a sweet spot. It's a Goldilocks formula. So I typically have my clients take breaks in supplementation so you don't decrease your ability to manufacture and utilize what your body needs to be doing. That's one thing to watch on that. Okay. All right. Let's see here. Diane said, after 12 hours overnight fast, my morning urine is often 5.5. What should I be doing differently? I'm low carb. I finish eating around 6 p.m. I observe good sleep hygiene practices. There seems to be no correlation between dinner foods and morning pH. So this is what I want you to try, Diane, is number one, make sure you hydrate really well. Today, for instance, hydrate really, really well. And then when you go to sleep, before you go to bed, are you watching the news? I'm just curious. Anything that increases cortisol is going to increase urine pH and is going to decrease urine pH, is going to increase acidity. So we've got to do some alkalinizing practices. So you can have an orgasm. That's a huge boost of oxytocin, right? That can certainly, maybe read something funny. focus on that gratitude journaling when you're reading. Again, make sure you're well hydrated when you go to sleep, and during the day, those alkalinizers, those herbs and greens, and look at what you are eating for dinner, because maybe it has a food sensitivity in it. A big one, dairy, grains, soy, are big food sensitivities for many people. So that could be something that's interfering with your alkalinization. In my book, Keto Green 16, I have a whole chapter on what other things that can help you get more alkaline. And sometimes it's patient, but I'm glad you're checking. I want you to wake up with a urine pH of 7.5. So let's see. And also, before you get out of bed, do that gratitude practice and see if that shifts. But and again, focusing on low inflammatory keto green foods. All right. Okay. Jennifer said, how do you increase oxytocin? Oxytocin is one of my favorite, I mean, it is the most powerful hormone. It is the crowning hormone. If we think of oxytocin and our hormones as a group, think of a university, think of a, university, body, and your students are all hormones. They're all hormones. Each one is different, has their own role, their own mission, their, own purpose in life, right? That's like your estrogen, progesterone, testosterone, DHEA. And your professors, consider them cortisol and insulin. They're helping regulate, right? If the professors are like sleeping at the head of the classroom, not teaching you, the student body is going to be unruly, right? But if they're those great, remember that fabulous teacher you had? I remember my 12th grade AP history teacher. I mean, just loved her. She ran a tight ship. I mean, we were all, on board, listening, attentive. That's a good, that's why you create insulin sensitivity and moderate cortisol, so it's not out of control. You've got some happy student body. And at the head of that student body and teachers is the dean or principal of the school, and that's oxytocin. That's oxytocin. That is the leadership. That is the regal hormone, the queen, the king, the crown of the hormones. And that is the most longevity producing hormones. And certainly I've prescribed it and supplemented with it in patients who have had PTSD, trauma, sexual dysfunction, hypofunction, orgasmic disorders, but nothing beats creating it yourself. Nothing beats creating it yourself. It's liberating. And so how we can increase oxytocin, I mentioned orgasm, self-pleasuring, intimacy, kissing, hugging. So those are part of the sexual intimacy that increases oxytocin. And head massage, like, you guys, we love head massages. I mean, seriously, these dry bars that are popping up everywhere, foot massages, head massages, that's one of the reasons they become so popular and addictive. Head massages increases oxytocin. Laughter, your favorite movie. I say, have a good dose of My Big Fat Greek Wedding. Being a first generation America, I love that movie. It makes me laugh. I don't care how many times I've seen it. So laughter and connection. We talk about resveratrol being a very potent antioxidant. That's why we need a glass of wine, right? It's not the wine. I beg to differ. It is the family and friends that you are having that glass of wine in that provides the medicinal longevity benefits, and that is oxytocin. So having a pet, look at Susan right now. She is getting tons of oxytocin at this moment as she is cuddling her poochie there. And so oxytocin, we know that people live longer if they have animals. And we know people live longer if they're in happy marriages. Happy hormones, right, promote longevity. And that's oxytocin. And I know from going from a state of deep depression, PTSD, trauma, grief, where I, contemplated suicide more than once, this is a decade and a half ago, to being like, I don't have to fake being happy anymore. That's the power of these practices and these principles that affect our physiology. I call it the keto green way, the keto green lifestyle. Empower oxytocin, measure urine pH, decrease inflammation, balance your hormones. It's the best prescription I can write. Of course, I always like to write on a prescription pad, orgasm a day, please, Those are things you can do. And on my website at dranna.com, dranna.com, I have some more information on oxytocin too, as well as in my book. So there's a way you can get it. So let's see here. Joanna said, I don't have access to a continuous glucose monitor. What can you do instead? You can definitely do finger sticks. You certainly can. And again, measuring urine pH, getting into ketosis, checking uric acid levels, those are things you can do. But I highly recommend a continuous glucose monitor. You should be able to call your physician and say, can you please write me one just for biohacking and not diabetic, not pre-diabetic. You don't want those diagnosis codes on your insurance. Your rates will increase or you may get dropped. So for biohacking, and you can say, can you write me a prescription and pay for it cash? Don't even put it through your insurance. It's only $40, anywhere between $40 and $80 for a 1 month supply. So 2 continuous glucose monitors. All you need is the piece that goes in your arm, because you can use your smartphone, the NFC reader on your smartphone. And it will track your blood sugar. Freestyle Libre. It's worth it just to see for a short time what's going on. That can make a really big difference. So if not, just do a blood sugar monitor, finger sticks that you can do throughout the day. That's an option for sure. Isabel said, is it possible to know your cholesterol levels? I imagine keto raises them. My cholesterol levels and my pattern of cholesterol is optimal. So what I've seen in the keto green lifestyle, again, we don't do keto. We don't do keto dirty. We do keto clean, which is keto green. And so what I've seen in my client base is an improvement in cholesterol, all numbers. In certain patients with an ApoE, genotype, with that phenotype, I see who carry an ApoE genetic mutation, I'll see an initial increase in cholesterol and then it come back down. But what I see across the board is a shift from pattern B to pattern A. So when we're looking at cholesterol, we're not just looking at total cholesterol, we're looking at fractionated cholesterol. We're looking at all the like lipoprotein A, we're looking at the breakdown between cholesterol, but we also want to look at that pattern. Is it pattern A or pattern B? Is it big, large, fluffy cholesterol, or is it small, dense, dangerous cholesterol, pattern B? And so that's what we want to avoid. So thanks for that. Thanks for that question. And I think last I checked, my LDL was at 80 and my HDL was 70. So really, really good numbers. Let's see. How do you keep from losing weight on keto green if you are thin? Muscle, weight bearing, and make sure you're getting enough protein. Make sure we have amazing people in my keto green community that are and even in their 60s, 70s, that have maintained their ideal body weight throughout this plan and increase their energy levels as well as their weight bearing, their exercises too. So Joanna said, can someone who is high oxalate do the keto green diet? That's a great question. You have to remove some high oxalate foods. And we have members in my keto green community that have issues with oxalates as well as nightshades. So in keto green, in menopause, my new book coming out in menopause, it's a recipe book, but there's 5 6-day plans in here. And one of the plans is low oxalate. So one is keto green extreme. It avoids all nightshades. We have the very carb restricted carnivore-ish plan in here too, because sometimes you can't. We have a plant-based plan, we have a cleanse plan, and a carb up plan, because these are pauses that I've used with clients to get them to just fine tune, tweak their regimen to get success. And also because variety is the spice of life. And sometimes it's just that we need to change things up for a short amount of time to make a difference. So those are great questions. Thank you, Jennifer. Thank you, Donna. Let's see. Andrea said, do you drink wine at all? Oh, what kind of wine? I love wine. I love wine. I don't drink it as much as I used to. Because the next day, even with a glass or 2 of wine, I'm not my best. And I don't want to cancel my 6 a.m. workout. And even if it's a glass or 2 of wine, it often leads to me canceling my workout. I'm just not at my best anymore. And I don't know if that's part of this menopause, post-menopause journey, or something more. But I love red wine. I like low sugar wines. I'm a wine connoisseur. Seriously, I love, I'm a total foodie, my whole family, total foodie, gastronomiques in our family, wine developers. I mean, we love it. So I look for excuses to drink it, but not very much, and definitely monitor the sugar in the wine. Um, Mercedes, do you believe that MCT oil is a good thing to do? This, I actually interviewed Dr. Karan from Microbiome Labs on this very issue about MCT. I interviewed him in my Girlfriend Doctor show, the podcast that I run. And this can be good for you and it cannot be good for you. It really depends on you. And also, too much of anything is typically not a good thing. So I typically tell my clients, okay, we're going to use MCT oil initially to help you extend your fasting interval and to make sure you don't have the cravings. So we stop often getting from a snacking 3-meal, 3-snack lifestyle to a ketogene lifestyle. We have to change up a few things. Healthy fats, essential fatty acids, MCT oil, so medium chain triglycerides can really help with that. Stabilizing your blood sugar and decreasing the ups and downs that affect cravings. So often, like starting out in my ketogene, I used it, and now maybe like after I've been away on vacation, I'm coming back and jumping back into keto and I'm feeling hungry, I'll add in some MCT into my morning tea or something. So those will be ways that I use MCT oil. A little bit in my protein shakes. There's about 3 grams of MCT oil in my protein shakes. And I found that do really well with that. And there's options to omit that completely. Susan wrote, how do you diagnose MTHFR? That's genetics. Most labs are running those tests, or you can very easily do a 23andMe. It's $97 if you haven't done one already. I highly recommend it. Best money you spent, and it will should tell you, or if not, there's a third party that will evaluate those results. So check with your doctor. Quest Labs, LabCorp, all of those do measure for MTHFR, and it's important to know. But more importantly, I want to know your homocysteine. How does a genetic defect affect you based on your epigenetic environment? So let me see what your homocysteine levels are. Good question. Joanna said, what do you recommend to prevent osteoporosis or reverse it when you already have it? I touched on this earlier. Definitely, I'm big on testosterone, progesterone, DHEA, right? Those will help promote bone growth. Estrogen helps decrease bone loss, so you can add in estrogen there. But also, really supplementing with different forms of bone builders. So strontium, it's great. And I would typically alternate someone on 3 months of a strontium supplement, not with calcium at the same time. And definitely optimize thyroid, check urine pH and get an alkaline urine pH. Again, I love the work of Dr. Susan Brown on osteoporosis. She's a PhD. You can Google her work. That's her specialty. Really beautiful stuff. And I'm sure Susan has other recommendations. Diane said, definitely no news at bedtime. Bravo, Diane. Good. All right. Film Jedi said, okay, wait, recording. Oh, I'm going to get the recording. Okay, yeah, Film Jedi. All right, I will send you the recording, Film Jedi. I got you. Oh, that is my dear Susan. Okay, her alternate identity is Film Jedi. All right, Joanna said, can you still create DHEA yourself if you are in your 70s, or should you just supplement? You can absolutely. And the thing, we do that with supporting your adrenals. So before you start supplement, I would put you on 2 to 3 scoops of my Mighty Maca supplement a day and maybe a bioidentical progesterone cream, and give your body some of those building blocks that it needs for DHEA, and look at your baseline and then check 2 months later. And I probably still supplement you with DHEA. I use a topical DHEA on the pelvic floor. So my Julva cream, that use that. That's something that, again, it's no age limit on that. But I definitely like for you to do as much as you can. 3-day, camping trips, going to sleep with the sunset, waking up with sunrise, getting out in nature. Those are other ways you will see your DHEA improve. I definitely have seen that with patients too. And of course, getting a good night's sleep. Great question, Joanna. What about treatment for anxiety? I love that. So, treatment for anxiety, we always want to address the underlying cause of anxiety, but supporting your gut microbiome is a crucial treatment for anxiety. And so that is hands down really important. So, anything like sometimes it's probiotic supplementation. I always say, let's get rid of sugar, get rid of inflammatory foods, get rid of preservatives and artificial sweeteners. There's a lot of doing less of to promote healthy hormone balance. And then progesterone in the evening is often one of my things, especially menopause and beyond, right? Progesterone in the evening to help you get a good night's sleep. There's a way to take supplement progesterone accurately. There's information again on my website under my balance cream about that. It's important you don't do it every night. You take a few nights off. So that helps. And also magnesium L-threonate, magnesium glycinate, there's other great forms. There's Barton Scott. I did a podcast with him on my Girlfriend Doctor show on mineral supplementation. And we talked about magnesium supplementation for anxiety in that. And I would also refer you to Allie Miller, naturopathic doctor, Dr. Allie Miller. She wrote a book on anxiety, and she is amazing, a functional medicine practitioner who is excellent on that too. So these are definitely, again, decreasing inflammation, balancing hormones, supporting your natural first line of defense is so powerful. Film Jedi said, what about EMF with glucose monitor? Well, when I did it for the whole year, that was probably a good dose of it, and add that to all my other EMFs that I'm surrounded with. But it's definitely to consider, especially if you're having trouble sleeping. I would do it for the information that it helps. I mean, it really does do a continuous glucose monitor for at least a month. But if you're pre-diabetic or diabetic, the benefits outweigh the risks. The Freestyle Libre is the one by Abbott Laboratories. Jennifer said, recommendation for blood and other testing. So I use, I'll put it in the chat box here, Jennifer. The one that has my panels on it, and I don't get any money for this. It's actually just a benefit for me and my ordering labs. ultalabtest.com/Dr. Anna Cabeca. And on that, you'll see my panels, what I would order for my patients. So, and it shows you the breakdown. My VIP Elite panel has everything from pregnenolone to fractionated cholesterol to red blood cell magnesium to all our hormones in it. So I find that to be very, very powerful. Joanna says, will keto green help with fatty liver? Absolutely. And I would also add digestive enzyme support. And do I ever prescribe estriol or estradiol combo for vaginal dryness? Estradiol works on the mucosal layer. There are other benefits for estriol, but estrogen works on the mucosal layer. That's the first lining, just like the inside of our mouth, the mucosal layer. And progesterone, DHA, testosterone work on all three layers of the vaginal wall. So I get the benefits of estrogen without using estrogen by using pro-hormones like DHEA or using androgen hormones like testosterone vaginally. So those are things I really love. And sometimes I combine it, like when I'm prescribing hormones into a troche and, working, I typically do physician to physician consults, always happy to work with your physicians. And again, if I'm prescribing and compounding, I will do a troche typically in the perimenopause, menopause, just easier. And I can see the levels in the blood very accurately that way, pretty accurately that way. There's no perfect way to measure hormones. That's why we look at all different ways: urine, saliva, blood, serum, all these good ways. And we're going to look at every body fluid you have, right? At some point or another. It tells us something. So looking at your, I would use a troche and periodically use that troche, that lozenge, so to speak. It's a vaginally as well. And that's an advantage of combined hormones in in that regimen, that you can also use it vaginally. And the same with topical creams. Depends on the composition of the topical cream, but typically you can use it on the vulva as well. Monica said, what is the recommendation with the progesterone for cycling? So in postmenopause, I often find in perimenopause or premenopause, we like it from ovulation until menses. So typically day 14 to 28 in an ovulating woman, especially if we're trying to get pregnant. If we're not trying to get pregnant, maybe we'll start day 10 or day 8 if we're in the perimenopause region and not doing so well off progesterone. Then postmenopausally, I think I often sometimes see patients and they're on continuous progesterone, 200 milligrams orally every night. Well, 90% of that gets metabolized by the liver, negatively feedbacks to your body's own ability to produce progesterone. So I recommend taking 1 to 2 nights off a week or 3 to 5 nights off per month. So that's how I manage progesterone postmenopausally to give you that break. And the same with topicals. And I use the topical balance cream. It's one I created for myself, for my patients. It has progesterone and pregnenolone. And again, it has tripeptide in it. It was one of those peptide hacks for skin longevity and beauty and radiance, and also reducing age spots and sunspots. So that's why I put it in my cream. And again, I didn't want any parabens, phthalates, or any other endocrine disruptors in it. So there's so that's why I created the balance cream. And you still take 1 to 2 nights off per week or 3 to 5 nights off per month. And that makes a difference. Why take 200 instead of 100 progesterone pills? Monica, it really depends on you and what your physician's doing. 100 milligrams is equivalent to like a 10 milligram topical, and it may not be enough, especially if you have a uterus, to oppose estrogenic effect on the uterus. But if that's not the issue, then and 100 is getting you to sleep and you're doing well, then that may be enough. Ellen said, can you repeat the Ulta lab test? So it's Ulta, and I put it in the chat box here, ultalabtest.com/Dr. Anna Cabeca. Ulta Lab, to see if that link works. If it doesn't work, let me know. ultalabtest.com/Dr. Anna Cabeca, Dr. Anna Cabeca, and that'll take you to my pages. Okay. So in talking about additional biohacks, I want to address like some of the key ones that I mentioned. So EMF blockers, but definitely Susan's more astute at that than I am for sure. And using bioidentical hormones. And I think as post-menopause, bioidentical progesterone and a little bit of testosterone goes a long way. Physiology affects our behavior. And this is often a problem I see in some of our hormone clinics, is we're prescribing too much testosterone. And then that creates novelty seeking behavior, anger, aggression, divorce. And that's not the reason to optimize to biohack, right? So when it comes to these aspects, the other part is stem cells. We now have the ability, and there's certain longevity clinics around the country. Here in Dallas, there's Gladden Longevity, Gladden. I like his work. I like what he does. I interviewed him on my Girlfriend Doctor show last year too. And so he has, does IV stem cells with a laser magnifier to really target the results and the organs of interest for the stem cell effectivity. And I think that is science of the future. I think we're definitely going to see that. And peptide therapy, injectable peptides. We know BPC 157. I wrote about that in my first book, The Hormone Fix. Or maybe it was in Keto Green 16. Oh my God, they're blurring together. That's terrible. Okay, so supplements. That was probably in Keto Green 16. So BPC 157 is a great peptide. And there is some oral forms of it or injectable forms, and other peptides that we use depending on what we're targeting can be, again, very beneficial. Laser therapy for rejuvenation. When I talk about vulvovaginal rejuvenation, there are certain laser therapies. Again, pelvic floor, I call that the most important real estate of your body, clitoris to anus. All right, guys already know, they're important. But women, clitoris to anus, the most important real estate of our body. And so, but as we get older, the research shows Vulvovaginal lasers don't work as well on postmenopausal women. They do, however, if you're hormone optimized. So using Julva clitoristane, this is my cream, or something similar, have your doctor prescribe something, but this has DHEA in it, and some plant stem cells from the alpine rose. And that combination is really powerful and is rejuvenating. So I have a 65-year-old patient who emailed me not too long ago. She's been on Julva since it came out. She was one of my patients in Brunswick, Georgia. And she goes, Dr. Anna, I went to my gynecologist. She said I have the vagina of a 25-year-old. I'm like, oh, that is a good way to introduce yourself from now on. I told her. So I said, Sharon, start telling people I'm 65 with the vagina of a 25-year-old. And I think that just cracks me up. So, and she got married, and as a result of this, right? Because, times it's a challenge being a single woman. She owns an accounting firm. She's a CPA, and life is hectic, right? But it's 2 years ago, like through this hormone optimization that I've done with her and following the principles early on, early adopter of my keto green principles and using my products, she got married 2 years ago. She got married to the love of her life. She goes, I've never been so happy in a relationship. So they're 2 years into their marriage. They have beautiful intimacy and connection. And that could be very contrary. I have another client, her name's Nancy, and 57 years old. She met the love, dating, worked with, dating coach, was dating. And then she met the man that she fell in love with. And she goes, I want to marry this man. That I can't, like, it hurts to have sex. I've had 3 urinary tract infections. I went to my doctor and she said, I'm going to put you on daily antibiotics. And I said, I've got to call Dr. Anna. So Nancy called me and said, Dr. Anna, is this the next, right? Is this what I'm supposed to do, is daily antibiotics just so I can have sex with the guy I love? It doesn't seem right. It hurts to have sex, but it's so important. And I said, no, this is what we need to do. I said, first of all, because she was having urinary tract infections and vaginal odor. I'm like, we call that honeymoonitis. So you've jumped the schedule a little bit and getting honeymoonitis before the honeymoon. But we call that, and that's because semen is alkaline, and the vaginal pH needs to be acidic. As we get older, the vaginal pH becomes more alkaline, it increases. And so there's that barrier, we're losing that acidic barrier to prevent infection. And so we get this bacterial vaginosis, this odor, these amines, this smell. And so we want to improve the vaginal mucosa and pH in your natural secretion so you don't get that. So anyway, I said, okay, so you don't need antibiotics. So do this, increase your vitamins because of the bladder infections, take a probiotic daily, pee after you have sex, increase your vitamin C to 4,000 milligrams. You guys, this is golden stuff. I mean, write this down. All your girlfriends want to know this. So 4,000 milligrams of vitamin C, probiotic daily, pee after you have sex, and use Julva clitoristane. I increased it to twice a day and use it with sex. She called me back, and she was like, oh my gosh, I haven't had another bladder infection. We're having more sex. There's no more odor. I am loving it. And he proposed. And anyway, they got married last September in the midst of a pandemic, and they are very, very happy. So it could have been very different, right? That could have been very different situation. So, certainly there's more to sex than in a marriage, right? But that's that piece that increases oxytocin between a couple keeps us together. And that's that anti-aging hormone. That's that longevity hormone. It just makes a huge difference. Anyway, beautiful. Okay, Susan said the link works. Can you put in the chat who you recommend for stem cells? There are a few doctors that I recommend. Susan, can I put them in? Definitely Dr. Gladden Longevity. So I'll write that in here. Gladden Longevity here in, and yeah, tell him I sent you. I like his work. I like what he does. He's here in Dallas. Amy Killen in, I think she's in Salt Lake City, Utah. And Dr. Todd is in, Dr. Todd Ochbesky, I don't remember his name, something, and he's in Southern California. Those are some amazing, and Dr. Marcella is in Austin. Dr. Marcella, I can't remember her name, in Austin. Those are some docs that I know, because I know them because they've been in Da Vinci 50, again, this select group of longevity biohackers that are in the group. And I know them and I know of them, and I know they come highly vetted and are at the top of their game for a reasonable and sound, safe practice. So that's for stem cells. Those are for stem cells. Okay. I like using a bioidentical progesterone cream versus oral. Again, I want to bypass the liver, the burden on my liver as much as possible and save that burden for a glass of wine here and there. Just kidding. But but you can use it both ways. Oral progesterone has a bigger sedative effect than transdermals. So I often will use oral progesterone if definitely have some difficulty sleeping. And yeah, so, okay. All right. Okay, so let me share a couple more slides, and I'll come back to more questions and then talk about anything else that Susan wants me to talk about. I do want to share for a second about my new book. So I'm really excited about Menopause coming out, and I'm really proud of it. It's a beautiful color book, and if you pre-order before April 12th, like now, today, at dranna.com/menopause. I know, great name. There are pauses in the pauses in our life where the magic happens, for sure. And so this says 5 unique eating plans to break through your weight loss plateau and improve mood, sleep, and hot flashes, for sure. Men can do it too. Kids can do it. It's sound practice, sound plans. And so want to invite you to pre-order Menopause, come back to my website to get $20 off to my store. Again, 100% guaranteed. I wanted to show you this picture to talk about longevity and biohacking and what I've learned through my own personal family history, as well as how we incorporate food as medicine. So these are images of my father, William Vieira Cabeca, Portuguese heritage, U.S. Navy, World War II, born in 1926. And when he was 79, he came to visit. My dad was a naval attaché for the U.S. Navy for 20 years. He grew up in New Bedford, Massachusetts, spoke Portuguese and English. He was sent internationally as an attaché or spy and learned Arabic, Hebrew, Portuguese, and did undercover work in the Middle East, etc. He was someone you can kind of tell from the picture on the right, but his smile was, and for me, certainly contagious. He could get anyone to talk. He could make anyone drink and get them to talk about anything. That was his claim to fame. And when he was 79, this man, sharp memory, and we'd lost our mom, my mom, his wife, probably 10 years prior at this point. And so he was 79 years old, and he came, and this was probably 2005, came to my house in Georgia, and in the airplane, he flew from Philadelphia, and he had to take a wheelchair in the airplane to go from point A to point B. And when he arrived, he was pushed out in a wheelchair, and he was cranky and irritable and, had brain fog, and he just wanted to sit and watch TV. And I was like, Dad, what is going on? I mean, this isn't like you. And he's like, yeah, Anna, I just don't feel good. I said, you want me to call your doctor? Do you want me to call Dr., your Dr. B? Do you want me to call him? And he said, yeah. And so I called his cardiologist, who had been the doctor who took care of my mom as well. I knew him well. And I said, Dad's not doing well. He's, I listed out his symptoms, his complaints, his vital signs, his blood sugar readings, all this stuff were in the 200s with 100, while on 120 units of insulin. So he was diabetic, and he was diagnosed with high cholesterol, and he was on 7 medications, and no 2 of which, may I add, that have ever been studied together long-term in any individual. So I looked at, I called his doc, and I asked him, what do you want me to do? What can I do for him? And he said, Anna, your dad's 79 years old. He's lived a good life. Essentially washing his hands of my father. I paused politely to wait for him to finish his statement, like, hey, and let's do A, B, and C, D. And he said, so that was it. He's lived a good life. And I said, oh, okay, would you mind, I said, I'm a gynecologist, but maybe I've got a few tricks up my sleeve here. Do you think I, mind if I intervene and mess with his medicines a little bit? And he goes, yeah, do what you want, Anna. He's lived a good life, and let me know if any updates you have for me. I'm like, okay, thank you. So I go back to my father, and he's sitting in his master suite that we built for him. And I said, Dad, your doctor's done with you. Are you ready to die, or do you want to live? And he looked at me and he's like, Anna, I'd like to make 80. And I'm like, okay. So but will you listen to what I do? He goes, Anna, I don't feel good. I've never felt this bad in my life, and I'd rather die than live this way. And again, he was irritable and just not himself. And I said, okay. So in 30 days, this man at 79 years old, whose cardiologist had said, there's nothing else I can do for him. In 30 days, he lost 30 pounds. A very earlier form of my ketogene definitely detoxed him. I took him off 3 of his medications. He went from 120 units of insulin per day to 20 units of insulin a day. I added fish oil supplements, omega-3, a purified omega-3. I added testosterone injections. I added CoQ10 and a multivitamin and mineral, and that is it. That is it. And not only did he go from 120 units of insulin a day to 20 units of insulin a day and lose 30 pounds, he got off the couch and was out on the tennis court with the kids, laughing and beating us all in poker. So that gives you an idea. That gives you an idea of the power. There's no age limit. Not only did this man, William V. Cabeca Jr., make 80 years old, he made 91 years, 91 good years. And that's with 30 of those years as a diabetic. 30 of those years as a diabetic. So, I mean, a tremendous power, tremendous difference. And I think that's what's so powerful. You guys, please follow me at my website, dranna.com, my Instagram at the Girlfriend Doctor. It's where I keep track of my kids. So you guys can really find me there. And those are some good ways to connect with me. So at the Girlfriend Doctor, and certainly my podcast, my show, my YouTube channel are all really good ways. Joanna said, Portuguese and born in New Bedford too. We're the Cabeca Mello family over there. So Susan said, really excellent. Thank you. You are very welcome. All right. I think I have some time left for questions. Let's see. Okay. So Kay Meadows said, you talked about progesterone and testosterone, but nothing about estrogen. So estrogen, I always start when I'm starting hormone replacement, I start with DHEA and I start with progesterone. And then I'll add in testosterone and estrogen, because all of the above, progesterone, DHEA, testosterone, convert to estrogen. I want to make sure that I'm not getting too much estrogen. Often an issue is estrogen dominance to begin with. So, supporting your body with, and plus I don't want to add additional estrogen or any hormone until I'm opening up those detoxification pathways. So I support detoxification in many ways. And again, I write about this in my first book, The Hormone Fix, because number one, we want to reduce endocrine disruptors, and we want to improve estrogen detoxification. So we improve it with certainly omega-3s, flax seeds, healthy fibers, relieving constipation. And because constipation is a good way for toxins to reabsorb into your system, as well as toxic estrogens. And we want to look at serum levels of 2, 4, and 16, well, at least 2 to 16 hydroxy and methoxy estrogen ratios. So we want to look at these things. So often balancing out, decreasing any preserved foods, decreasing exogenous hormone from endocrine disruptors is a really big, reducing the hormone burden on your body, supporting liver detoxification, phase 1 and phase 2 liver detoxification, supporting gut microbial diversity. So the estrobolome is really critical. And then adding estrogen. Sometimes estrogen, just a quick first step when we're having significant hot flashes, and we can do a bioidentical estrogen patch or cream or troche. Those are good ways to add in estrogen as well. Monica said, how do you support phase 1 and phase 2 detoxification? No, wait there. Okay. How do I support phase 1 and phase 2 detoxification? So phase 1, typically our body will go through phase 1 elimination or releasing of toxins. And then phase 2 is to take this hydroxylated form and make it water soluble to eliminate it safely. So with phase 2 detoxifiers, we typically need the methylators, the sulfators, sulfouronidation, glucuronidation, methylation factors on board. On my website, there's a supplement called Keto Green Detox. And Keto Green Detox has a list of phase 1 and phase 2, has a PDF download next to it that gives you even more information. So like milk thistle to support liver detoxification is beneficial, chlorella, certainly fiber rich, and again, eliminating constipation. So how we detox also through our breath, through our sweat, through our urine, and through our feces. So those are some things that I definitely want to make sure I'm addressing. So phase 1 is releasing the toxin, and phase 2, safely creating water soluble molecules so that it is removed safely. Okay. Jennifer said, why do compounding pharmacies not recommend testosterone vaginally? I'm not aware. Okay, let's see here. Great question. Thank you, Monica, for asking that. Andrea said, what do you do for constipation? I'm gluten-free, dairy-free already. Any probiotics? I definitely recommend probiotics, magnesium, and vitamin C, and fiber. Make sure you're getting enough fiber. 75 grams of fiber may be what you need. Using prebiotics with your probiotics can be very beneficial. Also, oftentimes, if I have a patient with troublesome constipation, I will definitely increase their fiber. So for menopause, my second plan is a plant-based detox plan. Excuse me a second. And that's the reason, because many people, especially when we're keto green, can get constipated, especially when you start. When you're in it for a while, the bowels are really resuscitated, so to speak. So your bowel motility will be amazing. So definitely we'll do probiotics and make sure you're well hydrated, you exercise regularly. Those are important things to do. Magnesium helps with constipation. We want to heal the GI tract. So after I do a plant-based plan, I may put you on a cleanse. So 72 hours of bone broth only to give that time to regenerate. In menopause, each of the 5 plans are 6 days. I wanted those 2 72-hour cycles for gut mucosal regeneration. I believe that will really make a difference in being able to see how effective these dietary changes are for you. So I would be curious to see how you do as you go through menopause, which one helps you the best. I definitely avoid all laxatives, et cetera. And I've had people that have been constipated for 30 years, right? That have 1 or 2 bowel movements a week, have to put fingers in their vagina to help remove their stool and things like that. So you can, and then completely recover gut mobility function. That's powerful. That's powerful. So, so those are things, and definitely you see that you're gluten-free, but make sure you're grain-free completely. And let's see if that doesn't help. Andrea, thanks for that question. Edward said, what would you suggest for someone who has tried DHEA numerous times with negative side effects such as cystic acne and weight gain for a thin person? I definitely, would look at a topical DHEA instead of a oral DHEA. And again, I would use adaptogens. So the one that I've used in my practice, the one I created, is Mighty Maca. I've seen improvements from 70 to 200% improvement in DHEA after 2 months. So depending on your, what you're dealing with, but anywhere between 2 to 4 scoops a day, and recheck in 2 to 3 months and see where your levels are. So you mix the Mighty Maca just with some water, but maca is a huge adaptogen. I never use maca by itself. I used it in combination of the superfoods I created because number one, couldn't stand the taste of maca by itself. And I learned about it in Peru on my journey. And I write about that a little bit in my first book, The Hormone Fix. But so I experienced the healing power of maca, which is just a tremendous adaptogen, and have seen, but I couldn't do it by itself. So I incorporated these other superfoods in with it. And with this, looking at it clinically in my clients in a patient base, we saw an improvement of DHEAS in the blood of 70 to 200% in 2 months. So I think that's just a powerful, using adaptogens can be very powerful that way. So I would suggest going at it that way. And then if you're having cystic acne, I would think what's going on there. Again, probiotics, is is something else going on, maybe iodine insufficiency. And, again, we will try to detox through our skin as well. So we would consider that too. And certainly probiotic if acne is an issue any other time as well. Jennifer said, have you heard of the Women's Hormone Work Group? They suggest cycling hormones after menopause, women'shormonenetwork.org. So like depends on what they mean on cycling. So mean creating a menstrual cycle each month. By design, our periods do end. And so most of us feel better with continuous stable hormones, and we want to have the neurocognitive benefits of healthy, steady state hormones. So I would consider that. I've done it both ways in my, 3 decades of medical practice. However, I find that a steady state typically does work better. So, but I'm open to learning more. So thank you for providing that, Jennifer. Susan said, I know fatigue is really complex. Thought for chronic severe fatigue for man, late 60s, exercise lots. Fatigue appears to be worsened by exercise, take lots of supplements, has migraines frequently, better when reduced dairy and stopped all supplements. Any things you would try? I would definitely say, let's join in the keto green community, and definitely off dairy. I think, like say, there's a person shouldn't drink any milk other than their mama's breast milk. So when you're past the age, it is time to move on from dairy, right? We're the only species that drinks another species milk, not intended for survival. So yeah, I think, that's something that maybe that dairy is a huge sensitivity and could be a trigger for the migraines. So I would say try all my menus are keto green, and keto green are dairy free, gluten free, because I am. And that's right, I create these recipes for you and for me. So you can see how he does with that. And I sometimes adding a little progesterone at the temporal area in the evening can really help someone who's struggling with fatigue to get a better night's sleep. I would biohack with an Aura ring, or a BioStrap is a wristband that also looks at heart rate variability, sleep scores, and I would pay attention to that too. And it sounds like some adrenal hypofunction maybe. So using an adaptogen like the Mighty Maca Plus could be very beneficial for energy too. We want to look at what are the triggers.
And you're looking pretty good for your age.
Thank you. Thank you.
What are
Thank
your
you.
skin secrets?
Oh, I'm telling you, beauty from the inside out. Beauty from the inside out, and certainly the outside in. And then the healthy gut healing is tremendous. That is the key. I would say for healthy complexion, for beautiful complexion, you need healthy digestion. So one of the plans in menopause is a 6-day keto cleanse. And everyone who did it in my girlfriend doctor community also felt more radiant and glowing, and the skin was better. So I'm really, really thrilled about that. Ellen said, how do we order my book? So definitely go to dranna.com/menopause, or you can order it. And then it tells you all the places: Powell Books, your local bookstore, Barnes and Noble, Amazon. We're already #1 new release in Amazon. So, and definitely come back to my website to get the book bonuses, to put in your receipt number and get the book bonuses. And I feel honored for you to do that. So recently I had dental surgery. I had old root canals that got infected, and we know how dangerous that is. So another biohack is get rid of root canals, right? And even better, prevent getting them in the first place. So I did some ozone therapy in there. You would be very proud of me, Susan. Did ozone therapy before I had them pulled, but I had them pulled. And so as a result of that and putting some implants in to replace those teeth, I was given some pain medicine. I was given some like hydrocodone. And so for the first time in decades, I had constipation, terrible constipation. I had forgotten. I grew up, I was just like my patients. I would ask them if they're constipated. And they say, oh no. I'm like, how many bowel movements a day? They'd say a day, I have 1 or 2 a week. I'm like, oh, well, that's constipation. You need to have a bowel, 1 or 2 bowel movements a day. And it needs to look like dark brown banana. So I've come a long way. I had dairy, eliminating dairy was a big piece to relieving that constipation. But anyway, so having these pain meds reminded me of that time, and it was terrible. Like, you get, it's just painful. And I'd forgotten how, I lived for decades of my life with constipation. So for the past, maybe, since 2010, when I stopped dairy. So for the past 12 years, it was not an issue until this pain medicine reminder. You have to have pain medicine for anything. Be sure you take a lot of fiber, improve your vitamin C and magnesium so you don't get constipated. It's painful to deal with. And that's the other reason why I have a lot of patients with hemorrhoids and rectal fissures. And we use Julva in the rectum as well to help heal that tissue and decrease those side, those symptoms. So that's been powerful. So yeah. So, and when you don't have constipation, your skin's better too. So,
Well,
and regarding the thinning hair and hair loss, definitely is optimization, decreasing inflammation and improving hormone balance. And then again, oftentimes I use zinc because that interrupts that cortisol conversion from testosterone to dihydrotestosterone, the enzyme 5-alpha reductase. Zinc will help block that. So that's powerful and coming out this summer because hair, that's just important. I also have a sea buckthorn oil cream with other ingredients. That's a hair mask, a menopausal hair mask that I'm coming out with as well. So balance your hormones, decrease inflammation. That will help with thinning a hair. Again, I'm living proof, and so many of my clients are too. So those are some things that will make a difference. Mano said, thank you. One of the best speakers in the last several years. Aw, thank you. I appreciate that. All right. Well, on that note, I should definitely close because someone else might come up and chat in here that they disagree. So it's great to see you guys, and thank you for having me. Been wonderful to be here with you, and I appreciate your time and your energy and the space. Susan, thanks for having me on.